Perfect. Hello, Professor Lockett. Last video assessment for week 8, musculoskeletal is what I will do now. So, with the patient, I would do the temporal mandibular joint, so I would put my fingers just in front of the ears, right on that temporal TMJ area. I'm going to have you open your mouth, sir, and close it. And he does have, can you do that a couple more times? He does have some mild clicking, especially in his right jaw. Do you get pain with that at all, sir?
No, ma'am.
All right. And so then we could do protrusion of the jaw. So can you stick your jaw perfect forward? Can you move it side to side? Perfect. So the cervical spine, am I jumping ahead? No. Cervical spine, can you touch your chin to your chest? And can you point your chin up to the ceiling? Can you put, however you may be able to, can you put your ear, try to touch your shoulder without bringing your shoulder up? Perfect. Can you do that to the other ear as well? Beautiful. And then the cervical spine, you'd have him look, he'd just look towards his right. And then you could have them look this way, and then you could have them put it like against the resistance. So try to, perfect, and then the other way, which would be nice and strong there. So then the shoulder, and we're palpating and inspecting the area, all the joints, the skin color to see if there's any, is it inflamed, is it pale, or is it nice and normal, no change. His shoulders feel good, don't feel like he's had necessarily surgeries on him or anything. Do you have any pain to your shoulders?
Only when people rub them.
Only when I'm rubbing on him like that? And so you would have oh yes, I need you to stand up. That's why I couldn't remember for this one. So you'd have them stand up, and I want you, with your hands relaxed down here, I want you to kind of put them back as far as you could. Perfect. And then I want you to come all the way up. Put it up over your head. Any pain with that?
No.
And come back down. So then I'd like you to take your hand and put your open hand not really on the small of your back, but I'd like you to try to see how far you can reach those hands up. Perfect. And he is, can you turn sideways to show Professor Lockett that, or I guess, yeah, to show that. Is that the highest you could go up?
Yes.
Okay. Perfect. So then we would do the elbow, so you can set back down, sir. Did I do all that? And you put your head behind your shoulders. And then are you able to... Alright, moving on to the elbow. So you'd have him relax, and I'm just feeling his kind of elbow joint there. You shouldn't be able to feel the synovial sac, but if you do, it would be kind of bulgy filling. Good there. No pain with that, no spurs or anything like that noted. No. Can you take your hands and do kind of, I don't know what you call it, almost like a
curling motion?
Yeah, up and down. Does that hurt at all?
No.
And on the other hand, can you do that? Perfect, so that's looking good. So then I would continue on to the wrist and the hands, and so you'd actually be feeling with some pressure, not necessarily firm, but enough where you can feel the actual metacarpals, and feeling them in the hand. And then with the phalanges, you would take your pointer and thumb and actually go on each knuckle and see how it feels, see if it's inflamed, see if there's arthritic changes. And I do that to his hand as well over here. Doing finger by finger by finger, just as I did on the other hand. I know just roughly all of his joints are fine. He doesn't have any issues with arthritis. And then the hip will be one where I'll have to have you lay down, sir. And while he lays down, I'm just going to double check to make sure that you are seeing what you need to be seeing, Professor Lockett. Let me adjust our high-tech cameras here. All right. So, sir, with your hip, if you don't mind to test the range of motion for it, do you have any pain in your hips ever?
No.
So I'm just literally going to take my hand and feel his hips and see if there's anything especially if he was having any complaints, but since he doesn't have any complaints, that always helps. So, I didn't have you do the range of motion for the hands, so I will do that. But while you're down here for the knee, I want you to bring one of your legs up straight to make a 90-degree angle with your other leg. Perfect, and can you do that with the other side? Thank you. And then I'd like you to just flex your knee or bend your knee and bring it up as far as you can. Perfect. And then can you do that to the other one? And then if you don't mind putting one of your feet on the floor with your knee bent, and I want you to bring it in as much as you can, and then rotate it out as much as you can. And then if you can do that to the other leg as well. Perfect. Good. And so I'm going to have you, with your legs just like that, if you don't mind keeping one of them straight. I'm going to say this one just because we're running into space over here. Keep your right leg straight, and if you don't mind opening up that left leg, perfect. That's a nice, good adduction. Good abduction. No, abduction and adduction. All right, so then I'm going to have you come back up here, sir, and set back up. I'm going to do your hand range of motion, where with a flat palm, can you put your fingers down? And back up. Same with the other hand. It's okay. Then I'm going to have you take your hand like that and kind of go kind of hard without bending your arm to see how much you can flex. Good. And then open hand. No problems there. Tight fist. And 4. I don't know if that's actually good 4, but to me it's like the sign language 4. Perfect. And then 4, I'm going to test your muscle strength. So relax, 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 relax. Okay. Now contract and don't let me pull your hand down. So like, there you go. And then the other hand. Perfect. Way stronger than me. All right. And then you can do this test, and this is actually a good one for carpal tunnel. You can have them do this for 60 seconds, and if their hands are numb by the end of that, they should go see a specialist. So the knee, you can stop, sorry sir, I'm a bad nurse today. So the knee, I would just be inspecting. I guess I could have done this when he was laying down, some of it as well, but his patella, of course, because of the angle is that, is not going to be able to manipulate that and move around. But he's not having any inflammation of the joint. Any pain there, sir?
No.
It's nice and intact. So we would be able to go kind of like this too, to kind of get, I hope I'm not out of your view now. Let me see, I got a couple more, but I want to make sure we're in your view. Alright, so the ankle and foot, it does look like that they're laying back down again, but you would just feel the ankle, see if there's any gouty arthritic changes. You could see if he has any pain with that flexion and extension. And then his toes, no hammer toes. He has good feet for a dude. Alright, and you do that to the other side as well. Flexing. Oh, Broadway's trying to get in on this assessment. Yeah. Checking the toes. What's that checking out? And then the spine. So this one I will have you stand up, sir. I'll have you turned sideways and see if she can see this. So his spine is nice and straight, no scoliosis noted, no spine surgery ever needed. He has had pain recently, and he is getting chiropractic for that, but nothing that is huge. So, with the spine, if you don't mind putting your chin to your, I just want to see if you can do that all right. Perfect. And then do me a favor, I want you to bend over at the waist, curving the back to touch your fingers to your toes if you can. Nice, and back up. And then you can stand in place, try to keep your hips stationary, I guess is the word I want to look, and I want you to try to bend over as far as you can to both sides with hands relaxed, yeah. And then same kind of stance, good. I want you to pivot like front to back. Perfect. And the other way with your hips stationary if you can. Perfect. So that's how you would test the spine. And so I believe, I know I may have missed some things, but that is the musculoskeletal assessment for this week. Thank you, Professor Lockett.